Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the FMGE January 25 recall. So the first question, identify the instrument given, that is the Varies needle. Next question, a 4-year-old boy was brought to the emergency department with complaints of melena that contains gastric mucosa and acute intermittent pain in the right iliac region. On surgical exploration, the following structure was found. What is the diagnosis? The diagnosis here is Meckel's diverticulum. Next question. A 26-year-old female was brought to the EMR post-fire incidents. Face and lower limb were spared. Calculate the area of burn. So the area calculated is 40 to 50%. A patient with grade 4 hemorrhoids underwent surgery. Identify the instrument given. Here in the instrument given, it is the hemorrhoids band kit. Next question. The given image is of ulcer. Identify the marked structure. The marked structure here is the edge of the ulcer. Next question. Following a fight between two groups, a boy was bout with severe chest pain, distended neck veins, dyspnea, and BP 80 by 50 mmHg. X-ray shows the following findings. What is the diagnosis? Here the diagnosis is of tension pneumothorax. Next question. Identify the procedure. Here in the image, the procedure which is given is the intravenous pyelogram. A 33-year-old male was bowed with sudden onset acute abdominal pain, constipation since 1 day, constant hiccup, and sometimes vomiting. X-ray abdomen was performed. Identify the pathology. The pathology here is the sigmoid volvulus. During laparoscopic surgery, when inserting trocar for surgery, which of the following is most prone to injury? Here the answer is both A and B, that is superior epigastric artery and inferior epigastric artery. Next question. A patient with diffuse severely contaminated peritonitis underwent laparotomy and was left open after the surgery. Which of the following might help? So the answer here is normal saline soaked gauze. Next question. Which of the following is not related to this type of cancer progression? Here the cancer is the basal cell carcinoma and duration is not related to the type of cancer progression. Now next question. Patient was brought to the emergency department. On examination he was confused, eye movement to the pain and flexion to withdraw from the pain. What is the GCS? The GCS calculated here is 9. Next question. A 1.5-month-old baby boy was brought to the OPD with complaints of vomiting after feeding, failure to thrive, and on examination a firm olive-shaped mass is in the upper abdomen. What is the diagnosis? Here the diagnosis is pyloric stenosis. A 30-year-old female presented to the OPD with a lump, unevenly vacillated surface in the upper medial quadrant of the breast, overlying skin mildly ulcerated. On microscopic following image is obtained. What is the diagnosis? The diagnosis here is the phyllodes tumor by seeing the microscopic image, which is of leaf-like. Next question. A 20-year-old male patient presented to the OPD with given presentation, fluctuation in shape, size, mild numbness in the hand and occasional pain. What is the diagnosis? Here the diagnosis is ganglion cyst. Identify the level of lymph node in the neck marked. Here the neck level which is marked is of level 2 lymph nodes. Next question. A 22-year-old male presented to the emergency department with chief complaint of severe urge to pass urine but unable to do so. There is history of injury to the perineum. On examination, blood on the meatus was seen. What is the likely to be injured? Here the answer is bulbar urethra. Next question. A woman 2 weeks after delivery, complaints of bloody discharge from the nipple and fever. On examination, diffuse lump under areola is found. What is the diagnosis? Here, the diagnosis is lactational mastitis. Now, the next question. Spread of prostate cancer to lumbar vertebra is via. The answer here is venous plexus. Now, the next question. A patient with dilated tortuous veins of leg presented to the OPD and is diagnosed with varicose vein grade say 4A. What is the best preferred treatment? The answer here is endothermal ablation. Now the next question, identify the marked structure. Here the structure which is marked is the right hepatic artery. Now the next question, in a follow-up case of prostate cancer, what do we need to check? The answer is PSA. Now the next question, a 49-year-old female from Nagaland presented with right-sided hearing loss and tinnitus. On examination, dull tympanic membrane with lymph nodes in the posterior triangle of the neck were seen. Which of the following is the management for this condition? Here the condition is of nasopharyngeal carcinoma and the treatment option is radiotherapy. Now, which of the following conditions is associated with Hallman-Miller sign in the CT image given below? The answer to this question is juvenile nasopharyngeal angiofibroma. Next question. A patient presents to the OPD with hearing loss. On examination, Rinne test positive in the left ear and negative in the right ear. Weber's test lateralization towards the left, bone conduction test reduced in the right ear and similar in the left ear. Interpret the findings. Here the answer is sensory neural hearing loss in right ear. Next question. A patient with CSOM was presented to the OPD with seizures, headache, vomiting and photophobia. On examination and evaluation, homonymous hemianopia and epilepsy were present. Identify the condition with the CT scan given below. Here, by seeing the CT scan, we can make the diagnosis as temporal abscess. Now the next question. Identify the sign given in the CT scan below. Here, the sign which is given is the double target sign. Next question. A child with a past history of intubation presented to the OPD and with shortness of breath during playing about 6 weeks later. Identify the condition with the radiological image given below. This is the steeple sign and it is seen in laryngotracheobronchitis, that is croup. Now the next question, identify the treatment option with the image given below. The answer to this question is type 4 tympanoplasty. Identify the structure given in the image below. Here in the image given below, the structure which is marked is the buccopharyngeal fossa. Now the next question, which of the following is the nasal part shown in the image? Here in the image, the part which is shown is the osteomeatal complex. A patient was presented to the OPD with complaints of greenish black matter in the nose with merciful smelling. What is the diagnosis? The diagnosis here is of atrophic rhinitis. Now the next question. A 2-year-old child has a history of inhalation of foreign body. On auscultation, there was an audible thud. What is the location of the foreign body? The answer to this question is trachea. Next question. A child presented with respiratory distress, cough, unable to speak after eating custard apple. What is the initial treatment? The answer is Heimlich's maneuver. Now the next question. A 45-year-old male was admitted with respiratory distress. CT scan image showed nasal polyp with fluid collection in the sinus. Which of the following drainage is obstructed? Here in the image, the drainage which is obstructed is of maxillary sinus. Now the next question. Which of the following is the timing at which triphenyl tetrazolium chloride can elicit findings post-MI? The answer to this question is 3 hours. Next question. A disease with mitochondrial inheritance is inherited from which family member? The answer is mother. Next question. A child presents with features of short stature, muscle weakness, and learning disability. Chromosome analysis reveals a deletion on the short arm of chromosome 15p on the paternal side. What is the most likely diagnosis? Here the answer is Prader-Willi syndrome. Now the next question. A child is diagnosed with von Willebrand disease requires an understanding of the role of von Willebrand factor. What does von Willebrand factor primarily combine with? The answer is GP1B9. Now, next question. Which gene mutation is most commonly associated with Burkitt's lymphoma? The answer to this question is c-Myc gene, and the tumor marker AFP is increased in hepatocellular carcinoma or hepatoma. Now, the next question. An elderly male presents with an ulcerative lesion at the medial canthus of his eye and with pearly margins. On microscopic examination, it shows palisading arrangement of cells. Keratin pearls are also noted. Identify the lesion. Here the answer is basal cell carcinoma. Now the next question. A 45-year-old female presents with headache. CT shows brain tumors, which on histology shows Shamoma bodies. Which of the following is the most likely diagnosis? The answer is meningioma. Now the next question. Which of the following are changes seen in irreversible cell injury? The answer is B, that is amorphous density of mitochondria is seen in irreversible cell injury. Now the next question. Histopathological examination showed follicular cells with pink eosinophilic extracellular substance. It is seen in medullary carcinoma of thyroid. Next question. A 50-year-old female presents with a breast mass of 3 centimeters which was operated, and microscopic examination shows pools of mucin. Diagnosis is mucinous carcinoma of breast. Next question. A child presents with recurrent staphylococcal infections. Laboratory examination shows very low levels of immunoglobulins GAME and a low quantity of B cells. There is a normal reaction to environmental antigens on skin. What is the most likely diagnosis? The answer is Bruton's A gamma globulinemia. Next question. Gardner had thorn prick and spread of the lesions along lymphatics. The answer is Porothrix sinkai. Next question. Patient with HIV presenting with bouts of cough and fever, which medium is appropriate for the diagnosis? It is pointing to the diagnosis of TB, and the medium which is used for TB is the Lowenstein-Janssen medium, that is LJ medium. Now the next question and the last question for this series is: a group of students consumed fried rice and subsequently presented with vomiting. What is the most likely causative organism? The answer is Bacillus cereus. Thank you so much.